Fill your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you. Come this far, you understand. Fear's not allowed, where dreams can be lost or found.
That would be.
Go.
Hello and welcome to Healing Outside the Box. This is our 17th show, and tonight our topic is You Can't Poison Your Way Back to Health. I'm Traci Crampton. I'm a Reiki and EFT practitioner.
And my name is Rosemary Lachance, and I'm a Reiki practitioner. And we have with us tonight Dr. James Sensenig, a naturopathic doctor who has his own business in Hamden on Whitney Avenue. Welcome, Dr. Sensenig. We're so happy that you're here with us tonight.
It's my pleasure.
Welcome.
Thank you very much, Traci. Thank you. Thank you for asking me.
I'm going to read a little bio about Dr.
Okay.
Sensenig to tell the audience a little bit about him. James S. Sensenig has been practicing naturopathic medicine for nearly 30 years and is well known for helping thousands of people regain their health. Dr. Sensenig sees patients with complaints of all kinds and is particularly interested in the treatment of digestive diseases, headaches and migraine, joint and muscle complaints, and chronic fatigue. He also sees children with health problems ranging from asthma and eczema to the developmental delays and autism. Dr. Sensenig graduated from the National College of Naturopathic Medicine in Portland, Oregon, where he later served as Dean of Education. He was the founding president of the American Association of Naturopathic Physicians, the chairman of its Government Affairs Committee for a decade, and the founding dean of the College of Naturopathic Medicine at the University of Bridgeport, Connecticut. Dr. Sensenig has consulted for a number of government agencies, insurance companies, colleges, and natural product companies. He is on the faculty of Southwest College of Naturopathic Medicine in Tempe, is that how you say it?
Tempe,
Arizona, and the University of Bridgeport College of Naturopathic Medicine. Wow, that's a lot.
Busy man.
Yeah.
I'll say.
So you have been in practice for 30 years. And I guess the thing that I will start this out with tonight to ask you is, how is naturopathic medicine different from conventional medicine?
Well, I'm not sure what the short answer is. Naturopathic medicine, as you and I've talked about it sometime, and I think also maybe with Traci present before, in a nutshell, naturopathic medicine concentrates on restoring normal function or normal structure as a way to treat disease. That might sound trite or weird or strange, but instead of focusing on the symptoms, back pain, headache, migraine, digestive problems, one focuses on the patient and works to restore normal so that those symptoms are not present. So another way to think about that is that in the overview that a naturopathic doctor takes, we can all be healthy. And we are born to be healthy, and we're born to stay in health. And when we get off balance, when we move away from a center point, you might say, of balance, there are compensations that occur in the body. And those compensations are physical, mental, emotional changes, the symptoms of disease. What happens in the conventional school of medicine is the therapeutic intervention, we call it, is directed at the symptom. To a naturopath, the symptom always is from something else. There's always some underlying imbalance that needs to be addressed. So nothing, in a manner of speaking, nothing is ever what it appears to be. There's always something else. In fact, when I'm teaching, I tell students naturopathy is a little bit like being a 4-year-old, asking why. This person has a migraine, let's say. Why? It's not because they have pain in their head, and the treatment is not directed at the pain in the head, but it alerts the doctor to look at something else that might be out of balance.
Exactly. And I've known you since the early 90s when I first came to you.
Yeah, way back in the last century.
Suffering from a problem that I could not get cured by a regular allopathic doctor. I went all over, and I was having panic attacks, and I was tired, and I was, I'd feel good one minute, I'd feel terrible the next minute, I'd feel depressed. I felt like I was losing my mind, remember? And I came to you,
right,
they put me on some kind of a tranquilizer, and
I don't remember what it was. Right.
Yeah, right. But they put me on some kind of tranquilizer, and I was talking very funny and slow, and I didn't feel bad, but I couldn't function.
Right.
And when I came to you, you said, let me try something. And you checked my blood sugar, and you put me on a mineral, and you said, take this. Bang. Symptoms gone. From that day forward, never had them again. And I stayed on this, and I had low blood sugar. So that's, I always say, you saved me, you healed me, you cured me.
That's an interesting point. And there's actually two aspects of that we probably ought to talk about. The first is that there's nothing particularly esoteric about having hypoglycemia or low blood sugar, right?
Right.
And and yet what that illustrates for me, and this is happening, as many of your listeners know, I'm sure, this is happening a lot in medicine, where problems that are well known or possibly even identified in the conventional system of medicine are overlooked because the specialist or the physician is concentrating on a certain thing because that's his area of expertise. And if you don't have a symptom that fits in that particular specialty or about which that person has little or no knowledge, they're not likely to look there. So I know that there are skeptics who are watching who are probably saying, well, you just went to a bad doctor because they were concentrating on your complaint and they weren't looking at hypoglycemia, and anybody would have been able to pick that up. That, in my experience, is not the case. But the other point that you illustrate here is, I don't remember what we did. That was some time ago. But whatever we did, it was calculated not so much to treat the symptoms, but to help your body come back on balance, you might say. Now, again, that sounds trite, but if the body's not functioning properly, you have physical and mental and emotional changes that look like, smell like, are called disease. That's what disease means. And this sounds really weird, but it's a significant aspect to what's happening in medicine right now, or a significant aspect of medicine today.
Things have become so niched. Like, I've noticed, even my daughter had a situation where she had to go to the hospital, and I can't say that any particular person who treated her did a poor job. They were all magnificent, but it felt like everybody had, a piece of the puzzle, but they weren't coming together to give a good overall service. And what I love about the naturopath is you're looking at the whole body, the whole, emotional system, mental system, everything, and how it works together. And it's wonderful because it's not just like, oh, here's your stomach, let's treat your stomach, and that stomach's related, to your blood pressure, and your blood pressure's related to your thyroid or whatever.
Well, we should say right at the top, or I should say right at the top of the show here, there's a time and a place for conventional medicine.
Right.
Oh, yeah.
Absolutely.
There's a time and a place for conventional medicine, and one needs to have conventional medicine.
But even in that situation, I said she had wonderful care in a crisis. However, you still see how compartmentalized it was, so much so everybody had a very specific specialty that you wanted sort of someone like yourself to come in and say, here's the, give her comfort and explain what's going on between all these different pieces.
Traci, you bring up a point that I see the other side of with patients a lot, and that is that the way you're describing the care that your daughter got, you're talking about excellent, competent, wonderful care.
They've studied well, they've known, they've rehearsed.
It focuses on one thing. And it's like missing the forest for the trees.
I felt like you should be on the staff there to sit with my daughter and tell her, this is what's happening to your body, this is what you can expect, or somebody who could be the spokesperson to pull it all together. And that's what I feel when we come to your office is your role.
Well, and the flip side of this, the part that I see with patients is that approach to medicine has, and I'm sure many of your listeners will identify with this, it puts the consumer patient in a position of figuring things out for themselves, shopping around. You know, like one of the things that we kind of joke about when we describe this kind of thing is you're feeling, I don't know, extreme fatigue. You can't get out of bed in the morning. You're losing interest in your family. You know, your life's starting to fall apart. And you go to someone, let's say your family doctor, who runs some tests and says, well, there's nothing wrong with you. You know, maybe it's you're under a lot of stress, or, you know, it's your job or whatever. And you leave there and you think, no, it's more than that.
You still feel crummy.
You still feel crummy. Okay, so now what are you going to do? Now you're going to go to another doctor. So you decide, because you're at a cocktail party and somebody said, well, have you had your thyroid checked? So now you go to see somebody like an endocrinologist, okay? And you go to the endocrinologist, I'm worried about my thyroid function. That person tests you in the conventional model, and they tell you, well, there's nothing wrong with your thyroid. Well, doctor, what's wrong with me? Well, I don't know, but it's not your thyroid. And then,
So
you know,
and
so I see this all the time. People who are put in the consumer is put in the position often of trying to see different specialists or different doctors to get an answer, because no one's putting the whole picture together.
Exactly.
And this is no small matter. I mean, we have one of the lousiest healthcare systems on the planet.
Can I just share something? Because we had to go, I had to take, this was just last night actually, I had to take my daughter to the emergency room, and it wasn't a critical emergency, not one that she had to
Not life-threatening,
yeah,
right?
not
Okay.
life-threatening. But we get there, and they're like, no, this entrance is just for the ambulance. And then the entrance for, you know, walk-in patients at the ER was blocked. And I'm waiting there, you know, for the car to move. And then finally, a security guard gets that minivan to move out of the way so I could pull into this parking lot, which is completely full. So he's like, oh, well, we'll just give you a pass to, you can go down the street, take a right, there's a parking lot there, you can park there with this pass. I'm like, God forbid she needed immediate attention, you know, because he's telling me to walk down this, you know, with a 5-year-old, 6-year-old now, she's, you know, I had to go to a parking lot down the street. Then I got in the parking lot. They're like, park way in the back there. And I'm thinking, wow, you know, this is how you get into the hospital. And then just that experience alone was enough to...
Well, you know, the thing that bothers me is that, and I know this is going to sound maybe unbelievable to many of your listeners, but when you get past trauma care and emergency care and talk about chronic illness and a lot of acute illnesses, it's not that hard to turn that around. And this is because the body is smart enough to know what to do. I've heard somebody say recently, the body is the miracle.
If you just lean into it, allow yourself to lean into that, the body will restore itself.
Basic philosophical principles. Actually, I want to come back, if I can, to basic philosophical principles and catch to something else that I started to talk about the healthcare system. I said it's a lousy healthcare system. Can I throw out some numbers here?
Yeah, go ahead. And I have something I have to tell you.
You probably already know this. In the United States, we spend more money on healthcare than any other country in the world, by far. Not a little bit, but when you do the lists, when the World Health Organization or other organizations put this information out, the United States, according to the Healthcare Financing Administration, spends somewhere around 17 or 18% of our gross domestic product on healthcare. They used to call that the gross national product. Now it's called gross domestic product. In other words, almost one out of every $5 in the United States goes to healthcare.
Wow.
The next closest nation to us is Japan. Now, these numbers change from year to year and time to time, and I don't have the exact numbers, and somebody might want to go Google that or look that up tonight after the show and talk about it. But it's somewhere, for Japan, it's somewhere around 10, 11%. Now, that's a big drop, from 17, 18% down to 10 or 11%. And then the rest of the countries in the world rank somewhere under there. So if you're going 1, 2, 3, 4, 5, 1, the United States is way out in front in terms of the amount of money we spend from our, the total percentage of our gross national product or our gross domestic product. But you can measure it in other ways too.
Right.
You can measure it in per capita expenses. And there again, the United States is number 1. We spend more money per capita on healthcare than any other nation in the world. The last figures I looked at, which were several years ago, The average per capita expenditure in this country is around $4,000 per person per year. Now that doesn't sound like a lot, but the next closest country to us was Switzerland at $2,500. Wow. That's a big jump. And then from there, it goes down from there. Healthcare is the biggest bite out of most budgets. Your personal budget, the town of North Haven's budget, Chrysler, I mean, governments at all levels, small businesses, large businesses, it's a big part of the budget. I heard recently on a radio show that U.S. car makers are going to have a very hard time competing in the market for more fuel-efficient cars with other countries because of healthcare costs. Right? Something like $1,500 or $2,000 of your purchase price of an automobile is healthcare costs. That's not true in any other country. And it's true of every business, too. You walk into a coffee shop or any other business, 20 or 30 cents on that dollar is paying for health care, right? Now, what do we get in return for that? In the latest statistics from the World Health Organization, the United States healthcare system now ranks 37th in the world in overall performance. That means there are 36 other countries that are doing a better job in terms of the performance of their healthcare system. But get this, overall health of the population, when you look at it that way, we rank 72nd in the world.
Oh my God.
72nd out of 191 nations in the who are member states of the United Nations.
I laugh because I think that we look at it backwards sometimes. We think, wow, we have all this accessible medical care available. Everywhere you go, there's a walk-in or a surgery, outpatient surgery center, or pharmacies on every corner.
Every corner.
Right.
But I think we're looking at that backwards. That's appalling to think that we require that many.
Right.
That our health is so poor that we need all of these extra centers to accommodate us.
Well, and even though they're everywhere, you might say,
and we're still not.
We're still performing at 37th. You know, you mentioned that I helped to found, I think, a naturopathic medical school, and I've been the dean of several naturopathic medical schools. Sometimes I wonder if in medical schools themselves, can you imagine on the first day of medical school, you're a brand new student and you're sitting in a medical school somewhere in the United States. Are you told that the United States ranks 37th in the world in healthcare? We're about to teach you how to become part of that cadre of individuals who provides the 37th best healthcare in the world. Do you still want to stay? Or do you want to go to Cuba or somewhere else to go to medical school? Wow. I mean, I'm joking a little bit, but it's an appalling problem. It's out of control. And the answer is not in reforming the third-party payer system for better payment and so on. There's a whole other area for control. We can talk about that later if you like.
Yes, I would like to. But I have to tell you something. I have a friend of mine who has many, many problems with her body. She has many problems. And she goes to see probably 4 or 5 doctors, all specialists. I have told her to come and see you. I said, why don't you try this? She knows that I'm into natural medicine. She knows that that you're my main physician. You are the one that I go to for everything. She knows all this. You know what she said?
Oh.
I'm afraid. I'm afraid. I'm afraid to go away from my doctors. I'm afraid to try something new.
Let's talk about that, because that comes up. That comes up a lot. And actually,
so
it's sad to say, or depending on how your audience feels about that, that's a problem more in the eastern part of the United States and more here in New England, where people are more conservative.
Right.
So first of all, is afraid to try. And we can go in any of these things in more depth if you care to do that. But first of all, naturopathic medicine is nothing new. We're practicing medicine the way it was practiced at the time of Hippocrates.
And it's funny because I'll get comments from people who I tell that I see a naturopath, and they'll say, "Oh, I do it the old-fashioned way. I go to my conventional doctor." I'm like, "No, I do it the old-fashioned way."
That's right. If you look at the family tree of medicine, the basic principles that we're interested in, which we'll get to if you like, but looking at the whole person, and take your friend for example. You just said she's going to 5 different doctors. We have no way of knowing what kind of care she's getting. Let's assume she's getting the best of the best of the best from each of those individuals. Nonetheless, each of those 5 doctors is treating something different.
Right.
And I would be, I think I could honestly say that it's very unlikely that any one of those physicians is seeing the interconnectedness between the different symptoms that your friend is experiencing because of what Traci was saying. It's compartmentalized.
You know what? Excuse me. She's not gotten any better in a few years.
Well, that doesn't surprise me either, which we can talk about. But what the difference is here is that if you're thinking like a naturopathic doctor, all of those symptoms and all of her complaints are interconnected. Why? Because it's all in the same person. You can't have part of your body acting in one way without affecting some other part. But it's not a problem with this breaking down or that breaking down. It's the imbalance in the system which is manifesting in different ways. As far as being new, medicine for all of Western medicine that we have recorded, and still in classical Oriental medicine, is concerned with looking at the whole person and working to restore health. You know, when people study Hippocrates, there are 3 principles that come through over and over and over again in Hippocrates' writing. One of them is individualization. Everybody's different, and every problem or set of problems is unique to that individual when you look at all of the nuances and all of the complaints taken together. Secondly, in classical Western medicine, there's always been an emphasis on the body's ability to heal itself. In Hippocratic medicine, Hippocrates refers to what's called the physis, which is this power. It's spoken of as a power or an energy or a force that helps to heal the body. And we don't want to get too new agey about it. We could, but the idea is that the body knows how to organize itself, and as Reiki practitioners, you know that there are ways that you can help the body to do that.
Channel the energy,
And the third principle that comes through in Hippocratic medicine is you've got to support that. You've got to support the body's intention to heal itself. In terms of new or not new, the kind of medicine that passes for conventional medicine today is new. The idea of using chemicals that are foreign to the body in the kinds of doses that are being used now is a new way it's an accelerated way of practicing medicine. Actually, it's a few centuries old. And that's what we meant by the title of the show. You can't poison yourself back to health.
There are tons and tons of commercials on TV with new medicine. Constantly.
Right, I think what is it, just the United States and one other country?
One other, Switzerland or someplace. Yeah, they were saying that it's the only one that is allowed to do that. You're right.
To allow to advertise on television.
Advertise medicine. And one of your lectures that I attended way back then in the 90s, you had mentioned, you talk about old and new, how in the beginning, there was naturopathic medicine. It was all done by nature, right? And someone said, wait a minute, why can't I make money off this? Why can't I do something with this and make money? So they picked the herb, they took it to a lab, they studied it, they made a chemical equivalent, hence side effects.
Well, the side effect question goes deeper than that. And as far as the money, I think that when people are contributing to the general welfare of the public, they deserve to make a good living and to make some money. Certainly a lot of what's happening in medicine is driven by money. But from a naturopathic perspective, there's a rigid allegiance to a paradigm or a worldview that modern science has now thrown away. And this is a 19th century mechanistic view of the body. In fact, there was a study that was done, that was reported way back in 1985, and I think it was from the Dean's Council or the Association of Deans of American Medical Schools, where they stated that the curricula in American medical schools have not advanced, have not been updated in nearly 100 years. Now, let me explain that. It doesn't mean that we don't have more modern information and more modern technology. We do. But the basic ideas, the basic premise, the basic way of thinking about medicine and the body is at least 100 years old, if not more. And that's the symptom approach that we're talking to. Right. By naturopathic medicine being millennia old, what we're talking about is this time-tested idea where if you're healthy, you're not sick. So the goal is to restore normal health and normal function. Again, I know it sounds trite, but now we come back to the title of the show again with you can't poison your way back to health. You can't restore someone or help someone restore their health by using chemicals or agents or forces on the body that don't belong in the body.
Exactly.
It's the same thing as putting weed killer on your lawn. You're going to kill the weeds, but you're going to poison the lawn.
Exactly.
Right? And that's where we're at. The #1 cause of death in this country, or certainly second or third, depending on who you talk to and whose research you look at, is iatrogenic disease, or physician-called illness. Now, what do you make of a healthcare system where the leading cause of death is the healthcare system? Or a country where the leading cause of death, or one of the leading causes of death, is the healthcare system? I mean, this is outrageous when you really step back and take a look at it.
Or that our water supply is polluted by
Yeah.
pharmaceuticals.
The water supply is
Pharmaceuticals,
polluted,
yeah.
but people are polluted as well.
Right.
And not only are we polluted, but the pollutants that we're putting on our food and in our water are throughout the ecosystem. I heard an ad the other day for, I won't name the company, but a major American retailer was advertising organic coffee and suggesting that if everybody bought, they said if all of our customers, not everybody who consumes coffee, but if all of our customers bought organic coffee instead of the regular stuff, there would be this many thousands of or tons of chemicals that wouldn't be put in the environment just from the customers of this one company changing their habits.
Wow.
So, and this is also what kind of blows my mind. All of a sudden, everything's green. Everybody's going green. People are concerned about
people are using it as a nice little marketing tool.
it's right. It's exactly.
Jumping on that bandwagon.
The car companies, everybody is going green. And what do we mean by green? We mean by using chemicals and methods that are sustainable and that are part of the natural world, right? People are going out of their way to use products in their home that don't have chemicals in them, buying furniture, clothes, painting with things that are non-toxic, right? Except when it comes to medicine. We're still putting stuff in our body, which in this general overview are polluting the body. Controlling a symptom, but polluting the body, and therefore causing a new problem.
All right, you said that they should make money for the product they put out, but why did they ever have to do that in the first place? We had it with all the natural things. Why make a chemical equivalent? So somebody can make money.
Well,
I mean,
I'm not going to be the I'm not going to be the apologizer or be. It sounds like somebody I know in the White House, doesn't it? But I'm making up some words here, right? I'm not here to defend the whole conventional medical system, but you can. But the argument would be on that side. The argument would be so you have control over dosing, right? You have some standardization because plant medicines, to be honest with you, are going to change between the time of the year and the place that they're grown and so on.
But that's what a naturopathic doctor's for, to give you the right amounts.
That's right.
And so
that's what you do.
our
You have to
bodies
do that.
change seasonally too, and our needs change seasonally, and people don't understand that what might help you get well in the winter is not the same.
And that's
natural
you understand that.
Help you in the summer.
So they come to you and you help them to get the right dosages and everything. Yeah, I know. Going and get things off the shelf is a whole different thing.
Now, that also brings us to one of the principles that I know you and I have talked about before. Now, you've mentioned the word today to the listeners, allopathic, to describe conventional doctors. But I don't know if your listeners know for sure what that word actually means.
You should,
okay?
Go ahead. Explain it to them.
I have noticed that word is being used by conventional medicine more often now for describing conventional medicine. What allopathic means, allopathic is from two Greek roots that are put together that mean allo, the other or different, and pathic, pathos or pathology. Those are all the same word, and they mean suffering or disease. I mean pathos, right? Allopathic means the other disease. And it refers to this philosophical principle. And as a matter of fact, let me back up. If you look in a medical dictionary from say 100 years ago, the dictionary definition of allopathic is the art of curing based on contraries, by which, I'm quoting now, by which one morbid state is removed by inducing another.
Oh my God.
Now, it's a philosophical...
A play on words there that really rings true, yes.
Well, what's happening is, when you treat... Here's the problem. If you don't see the interconnectedness of the symptoms that somebody's expressing, and you're treating only the symptom as if it were the problem, you're doing what we call in naturopathic medicine suppressing the illness, and then something else happens. By definition, when you suppress a symptom or when you treat only a symptom, the imbalance that's in that person remains because you haven't addressed it, right?
It pops up somewhere else.
It pops up somewhere else, exactly. It's like that old arcade game with
Press
the
it down,
exactly.
the hole comes
That's
back
right.
up
The
in another hole.
whack-a-mole, exactly.
Whack-a-mole.
It's like whack-a-mole, and you've got a different doctor to whack each mole, right? You've got a gynecologist. That's right. That's right. So that's allopathic medicine by definition, creating a new problem in place of the old one, and it's not recognized as that in conventional medicine because there's no discussion of what in medicine is called the therapeutic rationale. There's a reason for intervening, and you have to know what you're doing to intervene. The therapeutic rationale in allopathic medicine is to stop the symptom, thereby creating a new one. Okay? Now, while that's not admitted to, what is admitted to and what's part of our culture is side effects. But that's what a side effect is. It's a new problem. It's a new disease, right?
Yeah, but listen, did you hear these commercials? The side effects could be
or death.
Yeah, or death at the end. They say, yeah.
Just to cover that.
Yeah, we just want to let you know you could die from taking this medicine, you know, and you could have get a sinus infection, you could get bleeding,
Right.
you can get this. These.
Well,
why would I want to put that in my body? I wouldn't want to put that in my body.
Exactly. And you know, Oliver Wendell Holmes predicted this very thing 100 years ago, 100 and more years ago. What he said was, it's because he understood the principle that I just talked about. What he said was, the stronger the medicines get, the sicker the people will become. And exactly right. That's exactly because when you use a medicine to stop a symptom, something else has got to happen. Let's use an analogy that your listeners can easily identify with. If a building's burning and the fire alarm goes off, the fire alarm is telling you there's a problem.
Right.
Now,
You don't have to shut the fire alarm
right,
off
the
and
prudent
stay
person
in
would
the
put
building.
out the fire, right? Right? But to stretch that metaphor a little bit, you know, what's happening is, in conventional medicine,
turning
you
off the
disconnect
fire.
the alarm because that's making noise and it's getting in the way. Well, the building's still burning. You go to someone with eczema and it's treated with hydrocortisone to make it go away, you've just turned off the alarm. But the fire's still burning.
Right.
And so it's going to show up, another alarm's going to go off, and it's going to show in another way.
Great
Now-
analogy. Great analogy.
Right? It's going to just keep,
Yeah,
the
that is.
moles that keep popping up are new manifestations of the same disturbance which has not been corrected. And to say that putting hydrocortisone on a rash is healing the rash or correcting it in the naturopathic model is totally incorrect. It's only suppressing it, only to reappear again in another way, which needs another kind of doctor. And this will go on and on and on and on.
Absolutely.
So,
When my daughter had an immune problem, and I shared this story before on our show, is that we went to several different doctors, all of it, again, very professional. I'm not saying that anyone treated us poorly, because they all did a fantastic job, but we had already been seeing your associates at the time, and by the time she got to the gastroenterologist, in order to do the test to see if she could be labeled a certain disease, they had to reintroduce foods that would make her sick. I said, no, I don't need that label. I know those foods make her sick. I'd rather just avoid them and keep her well, you know. I just didn't see the sense of making a child sick again so that a test could be done to confirm that she has X, Y, or Z.
That's
Right.
really.
That was just, the thinking behind that was just
Yeah, right, exactly.
bizarre to me.
Exactly.
I didn't need a label.
Right.
I'm like, okay, don't need the label.
right,
You know,
right.
You know, I'm probably going to go out on a limb here, but I think I spoke above it with your colleague at your office, Dr. Skowron. And we've talked about it, they collect for cancer and multiple sclerosis and muscular dystrophy and on and on and on. When are they going to find a cure? When is the last time they found a cure? All I can remember is polio. I can't remember anything after that where they found a cure, and yet they still billions, trillions, millions. I don't even know how the biggest thing. Why? You know what I'm saying?
Well, you're pushing one of my buttons.
Okay, push.
First of
there
all,
we go. Give it to us.
when I walk in a dry cleaner's or a restaurant or a coffee shop and I see a canister where some family is trying to raise enough money so their child can get medical care for one of these chronic diseases, I almost cry. This is the richest country in the world, and we can't provide medical care for everyone in this country in a way that's cost effective. It's outrageous. If we can get to the moon and back, we can do that if we had the political will and the leadership. And I don't mean health care reform like they're talking about in Washington, D.C. I'm talking about real health care reform. It saddens me to no end that families are put in the position of not getting medical care or having to raise money through begging for it, really, from strangers on the street so that their child can be treated for leukemia or something like that. First of all, where's the heart in the medical system? Turning a child away because they can't afford the medical care because I'm sorry you don't have insurance? In the United States of America, it's outrageous. We can spend the kind of money that we've been spending in this administration on a war in Iraq and we can't provide medical care? The second button you're pushing is the one about the insurance and the HMOs themselves. You know, you've got people paying higher and higher co-pays, and I know any doctors who are listening to this, medical doctors or otherwise, will also know this. The reimbursement to the providers is going, the public doesn't know this, I don't think. The reimbursement to the providers keeps going down, down, down. Every time your co-pay goes up, the reimbursement to the provider is going down, not up. Where's all that money going? It's going to the HMOs. You got people in the HMOs. It's that same corporate greed kind of thing. You got the leadership of the HMOs, and we won't name any of them on the program here. Everybody knows which ones they are or what they are. And find out, look at your HMO's annual report, find out what the CEO is getting. You know, I know of one where salary and benefits have added up to over $100 million a year from a healthcare company. Think how much healthcare you could buy for $100 million.
One of the points in that movie Sicko by Michael Moore was when that woman who worked for an insurance company found out that she wasn't being promoted because, you know, she wasn't turning away enough claims. I mean, it was secretly known after a while that the more claims you turned away, the higher your salary went, and so.
That's right. And you know, a couple of years ago, you remind me of a couple of years ago, there was a news story running around about an investigation of one of the HMOs. This was in another state, where when I forget what state agency did it in what state, but they found boxes and this is back in the old days when you filed claims by paper, boxes and boxes and boxes of claims that were just simply being stored and then dumped and never processed. And then the consumer was told, we never got that, and so on. But the other part of your question, I told you you pushed a bunch of buttons. First button is, when you say curing the diseases,
are we curing them?
They want to cure them. That's my question.
My experience,
I don't think so.
My experience has been no. As you said in my bio, I've done some consulting with governments, with insurance companies, with HMOs, and with colleges, and so on and so forth. One of the things that I've done, and I don't think I'm going to go into details here because I just want to talk about it generically, is I have a particular interest in some chronic problems that, in my experience as a naturopathic doctor, is easily cured.
Right.
There's a national foundation for this problem. Let's call it, you know, the XYZ disease, right? And I and my colleagues who've worked on this for years and years have met with the National Foundation several times about just look at this possibility, right? Oh. They're not interested.
This gets my blood
boiling. Do not want to know. Do not want to know. And I walk away. I walked away from their headquarters in Washington, D.C. thinking, this is years ago when I thought that people were really interested in this stuff, that I wouldn't have wasted my time otherwise. You know, I thought, what possible explanation could there be for not wanting to know how to deal with this problem? And there are two problems, I think. One of them, if I'm going to be really fair about it, is maybe they just don't believe it, because we want to believe that healthcare is so complicated and it's so hard to treat these things. That's one thing. But the other thing is, imagine if you and your national XYZ disease corporation or nonprofit, or you're raking in all those pennies and dollars from little kids who are walking door to door or whatever, and suddenly you find a cure. Now what are you going to do? You're going to have to get a real job, right?
That's right.
So, I mean, who wants to do that?
That's true. I mean, look, just cancer alone. Look at the research groups that would be out of jobs. Look at the cancer hospitals, the cancer doctors. people don't think about that, but my God, they collect and they collect and they collect, and there's
I think
cures.
There was one particular fundraiser that I remember. Oh, and the money is going to build a new center, a new hospital. And I'm thinking, no, the money shouldn't be going to build a new hospital, because if you're using it for the cure, you should be making people well so they don't need the extra hospital. And it's upsetting.
No,
it's very
that
upsetting.
and people don't see it. When I'm in the supermarket, somebody says, "You want to give $1 to the Jimmy
and
Fund?"
then you're like,
and I say, "No, they already found a cure for cancer." You should see the look on their face.
Right.
Well, I said, but they're not going to tell you. So, but I do it. I do it just to raise public awareness, because I would help anybody that has a real problem.
Right.
The money is just going to keep people working.
I had dinner with some friends from another country not long ago, and with this couple and with a bunch of other folks, some of us naturopathic doctors, and this fellow says to the group, "So how much do you guys pay in taxes?" And it was a pretty, everybody there knew everybody else. So they went around the table talking about the percentage of their income that they pay in taxes. And then this guy says, "And what do you get for it?" And people had to think about it for a minute, because he was saying in his country, people got health care was covered.
It was broken down, they knew.
Right? Health care is covered, education is covered, and what we call auto insurance here is covered in this country. And he said, "Do you realize that the United States is the only country, the only developed country in the world where health care is a commodity? It's not a right." And that goes to your profit question, I think. And if I may come back to the point about being afraid, you and I talked about this before, and we were talking about it a little bit before the show. The basic idea about naturopathic medicine, again, is to use substances, medicinally, of course, but use substances that will help the body return to normal function, not just treat the symptom.
Right.
This is an old method. It's at least as old as Hippocrates and older than that. Secondly, the risks involved here are very, very low, because those substances or agents or forces that belong in the body are less likely to cause harm than most of the pharmaceuticals that are on the market. Why? Not only because they're man-made, but because of the way in which they are used. Okay? Thirdly, your listeners need to know that when you see a competent naturopathic doctor, they're not going to take you off of the medication that you're already taking. Right. They're going to work with you to sort of build up your health on the one hand, while on the other hand reducing the need for those things. It's not either or, it's not black and white. You think of it a little bit like a process where over time you do this.
I've had people even come to my office saying the same thing, and now I work, an energy practitioner. It's the same thing. They desperately want to be off of a medication, but I also say, this is a process. You work with your doctor, you tell them, how you're feeling, and if you're feeling better, you decrease that. You try and tap into that inner intuition too, that inner guide, what's going on.
There's a time and a place for conventional medicine, and there's a time and a place, and there's a time and a place for therapeutic rationale that controls symptoms only.
Right.
But
it's more
the
of a crisis. It's more in a crisis, but here we are walking around as a society treating everything as if it's a crisis.
Now, the other thing your listeners need to know about being afraid is that naturopathic doctors go to medical school, not conventional medical school, but naturopathic medical schools. These are 4-year, full-time residential programs after college, the same way as a conventional medical school is designed. These schools are accredited by the federal government, and naturopathic doctors, like other doctors, are licensed by the state. They take state board exams, not in conventional medicine, but in naturopathic medicine. So in a state like Connecticut, there are only 14 states in the United States that currently license naturopathic doctors. Connecticut is one of them.
Really?
Yep. And
I didn't know that.
Yep. So one has to graduate from an accredited naturopathic medical school and be examined by the state board of naturopathic medical examiners. Most naturopathic services are covered by the larger insurance companies and the HMOs. Naturopathic doctors carry malpractice insurance and have the same privileges and reporting obligations as physicians of other schools of medicine do as well. So there's regulation and there's oversight, and this is not also a new thing, as I've said several times. Naturopathic doctors have been licensed in the state of Connecticut since 1923 or maybe 1932. I never remember. I may be getting it backwards. But for almost, in Connecticut now, almost a century, or at least 90 years or so.
I have to just, an aside, I know this doesn't tie into the fear, but you began in naturopathic medicine sort of, I won't say at the forefront because it's been for many millennia, but at a time, I believe, when it was probably very difficult for you to get started because conventional medicine was really taking a foothold.
Well, actually, the history of medicine goes like this. You're absolutely right. I'm probably third generation naturopathic medicine in the United States because that name didn't come into use until the end of the 19th century. 1896 is when the name was applied to the kind of practice that we do. But an interesting, Traci, I don't know if you know this, but an interesting thing about naturopathic medicine is that it became organized, you might say, in response to the ineffectiveness and the harsh treatments that were in use in medicine in the 19th century. Now, at the turn of the 20th century, there were doctors of all stripes that practiced medicine. There were naturopathic doctors, there were homeopaths, there were chiropractors, there's osteopaths, there's medical doctors, and I'm oversimplifying when I say this, but the practice of medicine was left to the creativity, you might say, and the intelligent intervention of the physician himself. That began to be standardized at the turn of the 20th century. So whenever you see somebody with Crohn's disease, here's what you do, and we all do it the same way. And as the dominant school of medicine consolidated its political and economic power, it sought to eliminate or discourage other people from practicing. And that's still the stance.
Yes.
And actually that comes to one of the other points. You want to control healthcare costs? Stop the favoritism and the subsidies for the conventional school of medicine. There's no free market. There is no free market for healthcare in the United States. And when you say you're going to change the regulations so that conventional doctors can compete with each other, that's not competition. The competition has to come from other schools of medicine.
Right.
Hundreds of millions of dollars in your tax money is being used to subsidize a medical school right here in Connecticut and in every state. In every state, well, not all states, but almost all states have a medical school that is supported by taxpayer money. The NIH is supported by your taxpayer money,
and so on and so forth. I mean, if you talk to 10 people in a crowd of 15, they're going to say, we want alternatives. We want our system to pay for alternatives. We're disappointed. We're not getting the care we need. Our health is poor. And they won't look for alternatives until they've tapped out everything else because insurance isn't covering it. And it's very, very sad because you're right, their taxpayers' money isn't paying for the services that they would choose to have.
Right. And this has always bothered me in a state like Connecticut, for example, because the state legislature has decided, by virtue of licensing different kinds of doctors, that there are different kinds of providers. There are medical doctors, there's osteopaths, and there are NDs who are primary care physicians in the state of Connecticut. And yet your tax money is supporting only one of those schools of medicine. Why not the others?
Yeah.
Right? And that should be true at least in the states that license naturopathic doctors, if not at the federal level. We can't go on doing what we're doing in the conventional school of medicine. It is not sustainable. The costs are through the roof, and the outcome is absolutely ridiculous. So it's got to get turned around. And the other thing I would say about the fear question, for example, what have you got to lose? If you're completely satisfied with your medical care and what you're getting from your current conventional providers, don't call me. But if you think that there's more out there, there is. And a competent naturopathic physician can be of help. There's hardly anyone, in fact, I should go so far as to say there's no one who wouldn't benefit from naturopathic medical care. Now, I don't mean they're going to be completely cured of their problem. I don't mean to say that. They might be. But what I do mean to say is that everyone can benefit from the services that a naturopathic doctor has to offer.
Well, I've been cured by natural medicine. I've been cured twice from your office, from you, and I've been cured from echinacea and silver and a formula for bladder infections and all the natural things without the side effects, because I get those symptoms. I have a very light.
Homeopathics I love.
Yeah, homeopathic medicine for colds was like unbelievable. It works. I mean, I know you won't say that, but I say it works.
Well, I won't say that it's going to cure you or everybody who's in your audience. I mean, how can you say that, right?
No, you can't.
You can't say that. But you can't poison yourself back to health.
Right.
Right? That's where we started the whole conversation. You can't use agents or forces or chemicals that are foreign to the human body in a way to restore normal function. It's an oxymoron.
Yes.
It's not possible. Now, one of the questions that you kind of alluded to is you said it works. And many people might be thinking to themselves, well, if it really works, how come there aren't more naturopathic doctors around? And how come I haven't heard about this before?
Right. Good point.
The reason you haven't heard about it before is it has to do with economics, and it has to do with politics, you know, and commercials. Right? It doesn't have to do with the effectiveness of the system. Now, the skeptics who are watching the show are going to say, well, where's the research? First of all, there's lots of research, but it is either not available or looked at or found to be part of the public discussion in this country, or it's dismissed because, oh, it just can't be. Homeopathy is a perfect example. I don't know what your other guests have talked about. Homeopathy is the use of medicines in very, very tiny doses to stimulate the body towards balance.
No, we haven't talked about it.
So tiny, in fact, that there's none of the substance in the actual diluent. Right? Oh my God, well, it can't be.
I know, it's so hard
You
for
see?
anyone to believe that that could possibly work, but I'm telling you, it works.
But see, here's the paradigm thing. This is not just thinking outside the box. There ain't no box. Right? See, the box is part of the 19th century way of thinking about the physical world. If you have a chemical that's been diluted so much that there's none of the physical chemical present, how could it possibly work? That simply doesn't fit in the mindset of the Newtonian view of the world. However, if anybody's been paying attention to the science and the scientific work of the last 2 decades, that's where we're at. Quantum physics, astrophysics, all kinds of research into consciousness and so on, and even into the behavior of water shows that water molecules can carry information.
Yes.
So now the conventional system has been laughing at homeopathy for all these years because they're still stuck in the flat earth view of the world. The science of today, if there's anyone who is listening to this who doesn't believe, I'm not here to convince anybody about anything.
Right.
But if you really want to know, look at the research on water and water memory and so on.
Right?
Right.
And hidden messages in water.
Right.
That's a great book to
And
start.
this might be, see, in our culture, we always want to know, how does something work? And this might be one of the reasons that homeopathy works. Okay? It might not be. There might be some other explanation for it. But a clinician should be interested in what's working for his patients. There are times in the history of conventional medicine as well where things are used because they've been empirically seen to work, even though you can't explain exactly what's going on. It might take 20 or 30 or 100 years to actually explain what's happening. For example, there was a guy in the 19th century who was telling doctors they need to wash their hands before they deliver babies. Name was Semmelweis. In order to reduce the number of infections that occurred afterward.
They didn't.
No, because what was happening is, this is before people knew about germs. This is my point.
Okay.
This is my point. But he noticed that those who were cleaner, mostly midwives, had better outcomes than doctors, who in those days would be in dissection labs and working in the hospital and then go right into a delivery room.
Wow.
That sounds bizarre by today's standards because now we know about this. But anyway, he was trying to get his colleagues to wash their hands. He was not very successful because he was laughed at. But it took another 30 or 40 years before people started washing their hands. Along comes Pasteur and tells us, I'm oversimplifying, along comes Pasteur and tells us about germs. Now, 30, 40 years later, we can understand how this observation could be. You can see how it worked. But in the mindset of any institution, including conventional medicine, until the new concept is grasped. It just can't be true.
And we were into just eradicating
It just
all
can't be true.
bacteria to the point where we're eradicating the bacteria.
Now the good guys,
that is
that's right.
The good bacteria,
important.
Right,
yes,
right.
definitely.
And that's a
And
whole
that's
other
getting
show.
back
You
out
could
of
do a
balance.
whole show on the side effects of antibiotics and the consequences of that. And nowhere is it more obvious than in today's children. 1 out of 100, or it depends on who you talk to and what research you look at, 1 out of 100, 150 children are autistic in this country.
Yes.
1/3 of Americans' kids have ADD and everything in between. I've been in practice 30 years, as you said, but it's appalling to see the health of our kids go downhill like it is.
Any further points you want to share with our audience, just to sort of lessen the fear about branching into a new way of thinking in terms of their medical care?
Well, that's an interesting question. I don't want to be put in the position of convincing anybody about
Right.
doing anything. I think
Just
more
a
importantly to say
step.
the
Make a step.
resource is there, and I get somewhat philosophical about this because this is what I teach when I go to these different naturopathic medical schools. The method, let's just say it this way, the approach that's being used in the conventional system of medicine has proven itself to be a failure. We spend more money than anybody on the planet for healthcare, and we're 37th in the world for our health system and 72nd in the world in terms of our overall health.
Wow.
Now, if that's the kind of healthcare that people want, fine. I'm not trying to talk anybody out of it, but people should know that there is an alternative, and it's not weird and strange and voodoo, and for those of you who are afraid of maybe new age labels and all this kind of stuff, it's not there. It's based in a science that is verifiable and workable, but it's a different way of doing something.
Thank you.
Yes, you know, we could probably do several shows on all this. There's so much to talk about, and there's so much to enlighten the audience about, you know. So maybe one day we'll have you back again. We would love
That'd
it.
be my pleasure.
We would really love to have you back.
Love to have
so
you
we
back.
thank you
for
so
coming.
much for coming.
My
and
pleasure.
For all that
My pleasure.
valuable,
Tracy?
valuable information.
Thanks for backing it all up with, you know.
Now we want to tell people how to reach you. It's Dr. James Sensenig, Naturopathic Medicine. His phone number is area code 203-230-2200. That's in Hamden, Connecticut. And his website is www.naturalhealth.ct.com.
Okay, and to contact us, you can call Rosemary at 203-627-7966, or myself, Tracy, at 203-232-3405. If you have any questions regarding tonight's show or any other show that you've seen on our program, you can email those questions to healoutsidethebox@yahoo.com. For show schedules, visit either of these websites, www.entirebeing.com or www.rosemarylachance.com. We're going to leave you with our quote as usual.
Okay.
Yeah, there, Rose.
It was our choice to come to this planet at this time, and one of the most important tasks is to heal. First heal ourselves and then others. Heal, heal, heal. Wherever we go, wherever we are, most importantly, it is the healing of our own perception until we see that everything is according to the grand organizing design.
Thank you.
Thank you so much for joining us.
See you next time.
See you in the next show. Bye-bye.
The window to the world you have made. Always know you are the vision